So hi everyone. Apologies for this delay. We had a technical issue, but now it seems to be solved. So thank you all for being here with us today. It's a pleasure to officially start the second International Conference on Policy Diffusion and Development Cooperation with this first webinar. It's of course not what we expected and the way we expected, but it's great that we are now safe and at home sharing knowledge about the topic that we would like the most. Before beginning my talk, I would like to thank all the conveners, the scientific committee, and panel organizers for supporting me in all the challenging decisions I had to make for the conferences in the circumstances of the pandemic. I would also like to thank the institutions that are involved in the conference, the support of the College of Public Policy of the Hamad bin Khalifa University, the São Paulo Research Foundation, and the partnership of the Brazilian Center of Analysis and Planning and the Laboratory of International Public Policies. I would also like to thank all the participants of the conference and friends and colleagues that are watching us now. My presentation will be brief. I will first present the background of the conference and the dynamics of the online format. Then I will share a few thoughts about what I would like the space to become considering the different unfolding of the pandemic. Finally, I will present our speakers and discussants and the dynamics of this webinar. But before introducing the background of the conference, I just wanted to make a test with you with Slido. So Slido is the app we are using for questions. It's very easy and simple. You need to go to the Slido website and type the event code 73631. The event code and the Slido website are below here in the description of the webinar in YouTube. So please go there and inform us from which part of the world you are coming from. First, I would like to start with a little background of this event. This conference started as a seminar back in 2016 when I organized a COSI workshop at the Brazilian Center of Analysis and Planning. We were a few participants, around 30 or maybe 50, that have been working for 3 days on the topic of policy diffusion. The idea was to have an international meeting, but especially to bring the discussion of policy diffusion in Brazil, where it was still very incipient. The workshop was great, and I thought it would be interesting to continue this network and organize something more structured. In 2018, the International Conference on Policy Diffusion and Development Cooperation was born. It was bigger than expected. We had more than 250 registered participants and 4 days of event. It was a blast. We were able to create a digital platform, which is policydiffusion.com, where you can find lots of material about the topic. And we built a network of more than 500 people all over the world interested on this topic. The conference was very important to show the scholarship on policy diffusion, the relevance to include the dimension of development cooperation in the analysis, and especially to show the empirical richness of Global South for policy transfer and diffusion research. After the impact of the second event, we thought that it was interesting to have a third one in 2020. Again, we received lots of proposals, finally accepting 99 papers and 6 posters, which are organized in 16 panels and 26 sessions. Our conference was scheduled to occur in the end of May, but in March, due to the pandemic, we had to change our plans. It was not an easy decision because everything was prepared and I had more than 1 year of work behind me on this event. So first, we decided to reschedule the event, possibly to 2021. But Brazil at that time had only 60 cases of coronavirus. And later on, 2 months after, when Brazil came with the United States, the world's epicenter of coronavirus, we understood that it was not possible to prepare or organize anything in such conditions. So, in order to keep our mission of knowledge production and exchange about policy diffusion and development cooperation and avoid losing all the work done, we decided to move the conference online. It was against a hard and challenging decision. And I have to thank all my colleagues that supported me and advised me in the past months, especially Leslie Paul and Chris Walker, and also other colleagues involved in the conference. So, how is the new online design of the conference going to work? Considering time zone difference and digital fatigue, we designed an event that is based on a long term. It is starting now with this webinar, and we will have three more webinars every one every 2 months. The next webinar is going to be on the 2nd of September. It's going to be about Latin America and policy diffusion, and it will have Cecilia Osorio and myself as speakers, as well as Jessica Benza from Peru and Raul Pacheco Vega from Mexico, that will be moderating and discussing this panel. The event is already on YouTube, so you can activate your reminder in our channel to keep following and include this on your agenda. The next step is between January and March of 2021, we will have 26 panel sessions. And finally, in the end of March, we will have all the plenaries that will conclude the conference. As we have more time to work now, we encourage all panel organizers to prepare a publications with the papers presented in the panels. All the details of the new online design is on our website, policydiffusion.com. As the conference is moving online, a lot will be happening in this YouTube channel. So I will kindly ask you to subscribe and like it. This will be very important for you to receive all the updates of the conference, and will also help us to increase our reach with the material produced in the conference. You can also leave your email in our website and receive our newsletter. All the material that is here in this YouTube channel is free, and you can watch more than 40 videos that we made in the past conferences with the most prominent experts in the area, such as Diane Stone, David Dolowitz, Magdalena Hadziski, and others. So I'm also concluding now, and you don't need to worry, I'm concluding. I would like to say something important before finishing, which is something that came into my mind with all this pandemic situation. In the beginning, when the pandemic started and we started closing our institutions and started working home and we had to postpone the conference, I thought I was very worried. And of course, I was very worried about everything that was happening in the world. But later on, after thinking carefully, I also understood that this situation offered an unprecedented opportunity for us to think more about our roles as researchers and how our research could help us to go through everything that is happening now. And for this reason, I would like to use the space of the conference for the next 9 months as well for a collective reflection. That is to build with you a collective reflection thinking about two main questions. The first question is, how can policy transfer research help understanding the circumstances we are living today? As a matter of fact, we are witnessing an intense movement on the circulation of ideas, knowledge, and solutions to fight against COVID-19. Just to mention a few, we can take the example of the World Health Organization guidelines for social distancing, hygiene, traveling, working, and so on, that are being adopted and especially translated in so many different ways by most countries. A second example is the case of education. We have now more than 1 billion students that have been affected by school and university closures. I imagine that many of you have been either teaching or learning online. So there are different models circulating across countries about how to do remote learning and especially about how to reopen education institutions during the pandemic. Third, something that a few years ago seemed a utopia is now happening. And I'm talking about basic income. The pandemic brought up the discussion about this, and most countries are doing some form of transferring cash to citizens to mitigate effects of the pandemic. And I'm not going to extend myself longer with these elements and these questions because I would like to leave this floor to Leslie Paul, who's going to present a very interesting and stimulating reflection about how policy diffusion can be paradoxical in the context of a global pandemic. Uh, and I would like to move to my second question. So the second question is, how can policy transfer research help COVID-19 responses? And this is a more normative question, which is related to our impact on public policy making. We know that public policies based on scientific evidences can be more effective. So today, around half a million lives were taken due to coronavirus. 60,000 only in Brazil. But COVID impact on our lives goes far beyond. It's also about food security, poverty, economy, education, and so on. It is vital for us to think about how can we help public policymakers to prevent and mitigate such situations. So I would like to use the conference space to think about on how can we translate research findings into practical advices. Olivier is addressing this question in a certain way in presenting in his presentation by defending proposals for the global health governance and then reform of World Health Organization. Now, before leaving the floor to my colleagues, I would like to inform again the dynamics of the webinar and introduce them. So Leslie Paul is going to talk first. He is the founding dean of the College of Public Policy at the Hamad bin Khalifa University and one of the conveners of the conference. Olivier is our second speaker. He's professor of the University of Sorbonne, Paris 1 in France. And Cecilia Osorio is professor at the University Alberto Hurtado, and she will be discussing our presentations directly from Chile. Presentations will take from 15 to 20 minutes, and then discussion about 10 minutes. You can ask questions via Slido. Again, the event code is 73631, and the link and information for you to ask questions via Slido are here below in the description in YouTube. You can ask questions by informing the speakers you want to address your question to. And now, with no further delay, I would like to invite Professor Leslie Paul to talk, and I declare the second International Conference on Policy Diffusion and Development Cooperation officially open. So thank you very much.
Well, thank you very much, Osmany. I'm assuming everybody can hear and see me. So thank you for inviting me and for this panel and to kick off the conference. It's been a pleasure to be associated with all of the previous conferences and the planning for this one, and to provide support as well through the College of Public Policy at Hamad bin Khalifa University that Osmany was mentioning. Let me see if I can start my slides. And one second. Okay. Doing this for the first time, so let's, here we go, okay. So let me share. I just have a few slides that I will use as a basis for my talk. So I'm presuming everybody can see these. So the title of my talk is The Paradox of Policy Diffusion. And let me state the paradox very baldly at the beginning, and then I'll come back to it at the end. The paradox that I'm exploring, and it's more a hypothesis than an assertion, but the paradox that I'm exploring is that in an age and with a particular issue like this pandemic, where we have more information, I think, than we've ever had before about the state of public policy and policy responses around the world, the level of coordination and policy diffusion is actually relatively low. So we have a surplus of information about comparative policy responses and a deficit, if you will, or a very low level, I would argue or hypothesize, of actual diffusion and borrowing. And to some extent, this contradicts the point that Osmany was making, the more optimistic point of view. So this is perhaps a more pessimistic take on policy diffusion and COVID. So at one level, everybody is aware that we've had, again, a relatively unprecedented amount of real-time information about the spread of the pandemic itself. I'm not talking about policy responses here. I'm talking about the actual problem and the virus and the spread of the pandemic. So these are two, excuse me, these are two very common sources of information about the spread of the virus. Each of these is just a couple of days old. The World Health Organization, which Osmany mentioned, and which I'll come back to toward the end of my presentation, provides real-time data on the spread of the pandemic. So behind all of this, of course, is a vast global apparatus of information gathering about the virus, its spread, and the collection of that information and its diffusion or dispersion through the website. The one that many people know and is cited continuously in the media as a credible source of information is the Johns Hopkins University Coronavirus Resource Center. Again, this is a tracker that tracks the number of cases and global deaths, unfortunately, and test results, all of the mechanics, if you will, and the basic data about the pandemic itself. In addition to these basic trackers of the phenomenon of the virus, we have, I believe, and I'd be happy to get comments from the audience and from my colleagues on the panel, we have, I believe, unprecedented amounts of real-time data about policy responses. So not the problem itself, not the virus per se, but what governments are actually doing to respond to the virus. And one would think, one would argue that, or assume, that this wealth of data about what other governments are doing would then become a resource that governments themselves would be using to either coordinate their responses or borrow or diffuse the reactions and responses. And anecdotally, at least, we've seen instances of something that I'll refer to in the final slide of biopolitical nationalism or corona nationalism, where governments have actually tried to uncouple themselves from the global system of policymaking and global coordination. So let me just walk through what some of these trackers are to give you a sense of the wealth of data and information that's actually available. So these are policy trackers. Policy trackers are a fairly common tool used by international organizations and NGOs, depending on the area that they're interested in. So one example that almost everybody knows is the Corruption Perceptions Index, which is put out by Transparency International. There's others like Freedom House. The World Bank puts out governance indicators. So these are all indicators or trackers of one sort or another that try to capture an important phenomenon of governance. And there are others that are actually also tracking government policy with respect, for example, to corruption, anti-corruption efforts. Global Integrity is an NGO that does this. But here, I think for the first time, we have a wealth of policy tracker information about what governments are doing, coming from a variety of largely international organizations that gives us unprecedented perspectives on, at a very granular level, about what it is that governments are actually doing. So here's one by the OECD, the Organization for Economic Cooperation and Development. This is their site on tackling coronavirus and controlling the, contributing to the global effort. This is a policy tracker that looks at three broad areas: fiscal and monetary policy, employment and social policy, and health policy responses. It also, however, includes data on educational policy, science and innovation, tax, and even the supply of disinfectants. The scope of the countries is a little bit different for each of the vectors of policy that they're examining, but the core of the sample consists of OECD country member states and G20 non-OECD member states. A second tracker, again from the OECD, is the Observatory of Public Sector Innovation, and this is an OPSI COVID-19 Innovation Response Tracker. So in this instance, the observatory, which is an observatory of innovation, is looking at or trying to track innovative policy responses. So not everything the governments are doing, but ones that are considered to be innovative. Governments themselves submit their innovations, and right as of about a week ago, a little longer than that, this particular tracker had a data set of over 400 self-nominated policy innovations that have been put forward by 57 different countries, including the European Union and the European Commission. The leading categories of innovations fell in the digital technology realm, and that's quite understandable, given that many of the policy responses have had to do with digital tracking, tracing, contact tracing, etc. A third tracker is put out by the International Labor Organization, and this is a tracker on social protection issues or social protection policies. This tracker is quite panoptic. It covers 195 countries, and it has 1,130 different measures or indicators of policy response, of which unemployment protection, income protection, housing, and special allowances account for over 50% of the indicators or measures. They're also looking at health and food security, and the sources that they're drawing from are primarily media reports and some government reports that are published online. So 195 countries covered over 1,000 different measures of policy responses in a whole host of social protection areas. The IMF, the International Monetary Fund, also puts out a policy responses to COVID-19 policy tracker. You would expect, whereas the International Labor Organization, the ILO, is focused on labor-related issues and social protection, the IMF is concerned more with financial policy responses. But again, it's very comprehensive. It covers 196 countries and reviews fiscal policy responses, and these include spending measures on health, support for households and firms, and tax measures. It looks at monetary and macro financial policy, so interest rates, bond markets, liquidity provision, bank credit and lending facilities, and also exchange rates.
Highlight, sorry to interrupt you. Apparently the link on YouTube is not working. Let me try to fix this very quickly.
Okay. Do you want me to stop then, or?
Yeah. Can you just stop for a second and then?
Sure.
It works. Can I say that it works? If you click on the right side, you see a picture of Leslie, and if you click on the picture on the right side, you enter the channel. Not if you click on the bigger picture on the left. You have to click on the right. And it was working for me.
I've got a little indicator up at the top of my screen that says live, and it seems to be
Yes,
suggesting
yes,
that you,
it's live, but it's in another link, not in the one we shared on with the. It's in a
Hmm.
different link. Uh,
Osmany, it works.
yes,
It works.
yeah,
When,
it's just that is in a different it's in a different channel. So there are people that are in one link and it's in another link.
yeah.
So and apparently there are 30 people waiting the other one. So let me see how I can try to transfer everyone from one to the other.
Okay.
Just 1 second, I think I'll. Yes, so I believe we can continue. I'm going to work on this, and then in any way, the video is going to be recorded and it's going to be available online afterwards. So sorry to for interrupting you, Les. Please, you can continue. Thank you.
okay. So what I was discussing were the first four of these policy trackers, the OECD's more comprehensive tracker of policies, the OECD's OPSI, the ILO, and then I had just mentioned the IMF, focusing primarily on financial policy responses, but again, covering a very large number of countries, 195. But it doesn't end there. We also have the United Nations COVID-19 response. This includes the World Health Organization portal, but it's a more general website that provides a portal into the activities of a variety of different UN agencies. You know, I'm going to list all of the different types of agencies and their respective areas of responsibility to give you a sense again of the scope, the depth, and the range of policy issues that are being tracked here. So again, because this is the UN, an international organization, it's addressing COVID through the lens of each one of these separate and distinct international responsibilities. So peacekeeping, humanitarian assistance, economic and social development, the SDGs, environment, water and sanitation, human rights, drugs, crime, terrorism, for example, the impact of the virus in prisons and exploitation through cybercrime, children, women in particular as caregivers and frontline personnel, and the unfortunate increase in domestic violence as a result of lockdowns, reproductive health, HIV/AIDS, UN Development Program, food and agriculture, the food security issues, refugees, migration and mobility, again, particularly around refugees and migrants, aviation, tourism, shipping, workers and jobs, education, information, communication, and technology. So each one of those areas is reflected by a different set of activities in the UN. And again, the policy responses that are being generated through the UN system are all being tracked in that particular website. This one is produced by the Blavatnik School of Public Policy at Oxford University. And it is a coronavirus government response tracker. So it is much more specific in its title about what it's doing. It is a bespoke, tailored tracker that looks at 17 different indicators for more than 160 countries in 3 broad areas. It's looking at containment and closure measures, school and workplace closings, public transportation, international and domestic travel. Secondly, at economic measures that governments have taken with respect to income support and fiscal measures. And then thirdly, health systems. So this has to do with testing, contact tracing, etc. What's unusual about this particular tracker is that they are trying to basically develop an index of what they call stringency, where governments are reacting more or less stringently to or more stronger responses to the pandemic through their policy measures in comparison to weaker ones. And unlike the other trackers, all the other trackers that I'm mentioning here, the Blavatnik government response tracker does actually try to compare countries along this particular metric of severity or stringency. This one is a COVID-19 observatory in Latin America and Caribbean, and it is put out by the UN agency, Economic Commission for Latin America and the Caribbean. This one tracks and monitors, again, a host of policy initiatives undertaken by countries in that region. So movement restrictions, health, policy interventions, economy, employment, social protection, education, and gender. And it also does this chronologically. So it's not only providing the responses in real time, it's also providing a kind of record of the interventions since December and more intensively since March. So what it can aggregate into is a rough index of the kind of activities, not the wisdom or the impact of those activities, but the level of activities that are being undertaken by different governments to respond. And so they have, for example, entries under social protection that include cash transfers, food transfers, in-kind transfers, guarantees of basic services, and other social protection. They have a labor index that looks at teleworking, paid work leave, paid sick leave, unemployment insurance, etc. And the final tracker is a daily clock for COVID-19 in Arab countries, the region that I'm currently in. And this one is put out by the Economic and Social Commission for Western Asia. Again, it's a UN entity. It is much closer to the WHO and Johns Hopkins in that it provides a clock on cases, not on policy responses as such. But the background work that EXQUA is doing in response to the crisis is definitely addressing policy issues. So there's a policy component that lies behind or in the background to this particular index. I had mentioned at the beginning the WHO index in conjunction with the Johns Hopkins one. And there I was highlighting the fact that the face of the WHO, the coronavirus tracker, is looking primarily or initially at the case distribution and diffusion of the pandemic. But it also has, as Osmany was mentioning in his opening remarks, a wide range of data about country guidance. So it has become, it presumes to be, a source of global standards and benchmarks and guidelines. Again, to give a sense of the scope, it lists a set of guidelines around critical preparedness, readiness and response actions for COVID-19, country level coordination and monitoring, the risk communication and community engagement, surveillance, rapid response teams, standards for national libraries, et cetera, et cetera. So the point I'm making, and this is the last slide, the point I'm making, I'm suggesting, I'm hypothesizing a bit of a paradox. Despite what would appear to be an unprecedented number of real-time policy trackers, there actually seems to be less diffusion than one would expect. Of course, some countries and some regions are borrowing from each other, but generally countries have taken fairly distinctive approaches, even if the ingredients are generally the same. So here's the paradox. Why, when there's a global problem and a global and global real-time comparative data at unprecedented levels, depths, and granularity on policy responses, has there been, relatively speaking, so little diffusion or borrowing or copying, or even one could argue coordination? So again, I'm not making a hard case for this. I'm exploring this as a hypothesis. Lots of data, a surplus of policy trackers, but a deficit or a very low level of diffusion. So here are 5 different hypotheses as to why this is the case. And I'll do this quickly and then maybe we can return in discussion. It's a global pandemic, number one, but the characteristics of that pandemic vary quite dramatically country by country. In terms of medical resources, level of economic development, demographics, the agedness of the population, the concentration of the population, the distribution in terms of urban centers and rural. So every country, and even down at the subnational level, has such unique configurations of conditions that solutions don't travel very well in this instance. We can get very general ideas about standards and responses, but the solutions have had to be very granular, very local in many instances, if not, at the subnational level. So this is a kind of crisis, a kind of policy problem that, even though it's global in character, is local in terms of its policy responses. So that's the first hypothesis. The second one is the possibility that international organizations have been somewhat discredited, and the WHO in particular. It made mistakes at the beginning, not just the US and Mr. Trump have made allegations about the WHO ignoring some of the data that was coming out of China. There's enough evidence to suggest that it was caught flat-footed in terms of its general responses. And it's been cast in a somewhat negative light. Again, the paradox is that there's lots of activity going on at the WHO and other international organizations in the UN system, but they've been somewhat tarnished in terms of their capacities, abilities, and contributions, at least at the beginning of the pandemic. That may fade, but this might also be an additional factor in halting or blocking some of the potential policy transfer that may have occurred through those international organizations. A third hypothesis is that a lot of the policy solutions required a logic of closure, a logic of blockage, a logic of pushing back on and not accepting, of closing. Travel restrictions, of closing borders, etc. So whereas the logic of policy diffusion and policy transfer is one of borrowing, copying, openness, trans-border movements, fast policy, to quote Peck and Theodore. In this instance, this pandemic actually encouraged solutions that had a completely different kind of logic, a logic of closure and resistance and go it alone, rather than borrowing and movement. A fourth, and this flows from the third one, a fourth hypothesis is that the pandemic encouraged, and these are two terms that have boiled up in the literature recently, corona nationalism in the context of the European Union, and another term that's been used is biopolitical nationalism. In both these instances, you have the going alone phenomenon that I was mentioning earlier, but also strangely competitive responses where we're either doing better or worse than comparator countries. And that sets up a logic, again, of competition rather than collaboration or borrowing. And finally, in the fifth possible contributor to this paradox is a comparison to the 2008 financial crisis. Some global crises generate collective response. We're all in it together, and the connectivity is such that only a global response will be able to address it. But sometimes some international crises, and this is something that I personally need to think a little bit more about, but the pandemic, while it has the potential to generate, and has obviously generated international coordination and cooperation and borrowing, also has the potential to generate a lifeboat mentality, that we're not all in it together, each man, woman, and child for him or herself. And at the national level, this contributes to the kind of corona nationalism or the biopolitical nationalism that I was mentioning. So again, this paradox of diffusion is something that I'm putting forward for discussion and as a hypothesis to try to pick up on this distinction between the amount of information we have about policy responses and about the actual diffusion and borrowing and coordination that's taken place around the world. Thank you.
Yeah. Thank you very much, Les, for this very inspiring presentation and for your very rapid reflections on such a complex phenomena that we are witnessing now. I would like to inform all the participants again that if anyone wants to address questions to Leslie Paul, they need to go to the Slido app and type the event code, which is 73631, and you can write a question informing the name of the speaker you want to address your question to. We had a little technical issue, but it's now solved with our YouTube link. And I would like to move on now to Olivier's presentation. So Olivier, if you can open your camera and microphone, and Leslie, if you can, yeah, Leslie has already his camera, his microphone on mute mode.
Hello, can you confirm that you hear me and you see me?
Yes, I can confirm that I can hear you and see you, but just let me wait till the image come to YouTube.
I wait for your signal.
Perfect. That it's working. So you can start. So you have 15 to 20 minutes. Thank you very much, Olivier, for being with us, for accepting to talk on this webinar.
Thank you, Osmany and Cecilia, for giving me the opportunity to present some personal views on the WHO, the World Health Organization, and the global health governance in times of COVID-19. I'm very pleased to present some arguments and findings I propose in the long policy paper that I drafted for the think tank Terra Nova, a French think tank, which is also co-branded by another French think tank called Global Health 2030. My presentation will focus on 6 main proposals for reforming the WHO after it has been highly criticized for the inefficiency of its response to the crisis. Is interesting because this note is targeting decision makers rather than researchers. So it's a normative paper which has some proposals that I would like to present now. Let's come back to the crisis we are living right now. It has been triggered by an agent, a pathogenic agent, and it has driven to a classic example of the difficulties of multilateralism. It shows the extreme difficulty of the UN system in fulfilling its mission of prevention and response of collective risk. Over the last 3 decades, we had 5 great epidemics, important epidemics, and in each of them, the WHO has been regularly criticized and under fire. Politicians and observers frequently underline, its failures, its gaps, its weaknesses to fulfill its mission of coordinating international responses. So one of the main arguments I try to defend in the policy note is that many of the WHO's challenges do not stem from internal deficiencies. Of course, there are some, and I will address some of them, but rather results from the lack of political support and political engagement that clearly weaken the authority and the legitimacy of the UN organization. As you know, like any other intergovernmental agency, the WHO has no power other than the one granted by its own member states, especially in crisis situations. And on the one hand, you all know that the WHO can rely on a legal instrument to respond to emergency crisis. It is called the International health regulation. But on the other side, what we can observe from facts is that the Geneva-based organization cannot act in practice without the full cooperation of state over which it has no coercive power. So can the WHO be exempted from criticism? Of course not. I told you, and Leslie just a few minutes ago mentioned this. The UN organizations show their limits in times of crisis. And for WHO, there's a long list of grievances, such as the lack of leadership by the Director General, weak financial resources, the dependency on donors, especially the big donors, the delays in allocating funds, also bureaucratic management of programs, the low flexibility and the low responsiveness in front of emergencies, and also internal rivalries and politicization of discussions that should be only scientific but are still political. So the COVID-19 showed these gaps. We all know that there were some delays in sending an international alert at the beginning of the crisis. We also know that there was a difficulty in exerting sufficient pressure from the Director General on the Chinese government. There was a lack of capacity of the WHO expert mission that was sent in China in January. There was some challenging in monitoring the epidemic. And last but not least, there was also a lack of capacity to provide leadership to embark all countries in a coordinated response. When we are faced with this, all these criticism, what can we do to improve the global health governance so that we have international organizations that can serve the interests of the countries and serve the protection of the health of the population? I would like to focus on 6 governance reform proposals that could restore WHO's leadership in global health governance. And I do not limit myself to the role of WHO in health emergencies, but also I would like to address the regular activities of the organization, those that are performed on a daily basis in times of calm, I could say. The final idea is to rebuild WHO's authority over what it does the best. It is the production and the dissemination of knowledge, promoting a universal approach to health. So the first proposal of the note is about strengthening the international health regulation. This is the legal instruments that the WHO uses in times of health emergencies. These instruments has been revised already in early 2000 to strengthen states' obligation to track and report emerging health risk arising in their territory. And this revision of the international health regulation has also given more power to the WHO Secretariat to coordinate the response to the crisis and to declare a public health emergency of international concern. However, what we could see in the management of the COVID-19 is that the WHO depends too much and still on the good faith of governments, on their willingness to share reliable and transparent information, and to host surveillance or evaluation missions under conditions that they do control. My proposal here is that we should revise the international health regulation another time and to tie the conduct of health emergency response to the principle of collective security. And this is possible. The UN Security Council since the early 2000s has recognized health as a major security issue in various resolutions. And nothing prevents WHO from being granted a mandate comparable to that of the International Atomic Energy Agency, the IAEA, to carry out binding inspection activities in countries, in states, to verify that their compliance with their international obligation. So to prevent future pandemics, it is essential that WHO to be granted the capacity to lead, to conduct mandatory and no longer optional inspection visits, and in the event of a clear breach of the international health regulation, the WHO should be able to refer the matter to the UN Security Council, like the IAEA, and then the Security Council could take the necessary measures to compel a state that do not cooperate to fully respond to its obligation. The second proposal I tried to address in the note is about reducing WHO's financial dependence on voluntary contributions. As you know, the budget is, of any UN agency is quite complex, but concerning the WHO, during the last 30 years, we had an important shift. There had been a budget erosion as a result of the zero nominal growth policy that was decided in the mid-90s, a budgetary erosion of assessed contributions. What we call assessed contributions, they are the compulsory contributions paid annually by the member states. And to compensate this budgetary erosion, WHO increased the level and also the donors, increased the evolution, the growth of voluntary contributions, both from public and from private donors. These voluntary contributions are conditional. Most of them are being earmarked for specific programs and for specific sets, a specific period of time. And what we can see, if we see the last 40 years, that the regular budget made of assessed contributions was 80% of the budget in the mid-70s. 40 years after, now the voluntary contributions are 80% of the budget. So these contributions results in many problems and have many negative consequences, because it affects the stability and the predictability of contributions, as donors may certainly redirect the contribution, reduce it, or withdraw it, and creating financial cuts. And that's has severely limited the WHO response to the Ebola crisis last time. These voluntary contributions also oblige the WHO to constantly align its programs to the priorities of the donors, and the donors may change, and the WHO may have to change its priorities. And thirdly, these voluntary contributions also force WHO department to on a constant on a regular basis to devote most of their time to fundraising, rather than focusing on their mission, which is to monitor, to collect information, to do research analysis, and to do some technical assistance. The most important part of these financial new conditions is that now WHO is dependent on contributions from private donors. The level of private donors has constantly been raised, and now there is no alternative but to resort to funding sources from international philanthropy, from public-private alliances, from pharmaceutical companies. And of course, this is a problem because WHO is following a public policy, not private interest. For example, the Gates Foundation alone was the second largest net voluntary contributor during the period 2018-2019. So the second private contributor to WHO, the second contributor is private. So my proposal would be to restore a larger share of non-earmarked contribution to WHO, at least 50% of the budget. So the WHO would be able to have more stability and more predictability in addressing its own priorities. The proposal number 3, it's about the problem of compartmentalization, stratification within the organization. And this is an internal issue that is quite critical and has been addressed several times by many observers. There is, for a long time, a great problem of authority of the Director General within his or her own organization. To a large extent, this question of authority are associated with government support, but not only government support. There is also inside the organization a problem associated with the regionalized structure of the organization. WHO is the only UN entity that is structured around 6 powerful regional offices. And this is a major impediment to institutional effectiveness, to such an extent that, the Lancet journal recently referred to the existence of 7 WHOs, the Secretariat and the 6 regional offices. What is the problem here? The problem is that a special feature of this organization is that the regional directors are elected by governments of the region they do cover. They have their own budget, they have full authority on their staff, and they can even play a key role on the appointment of national WHO representatives. It means that they have a double allegiance. They are placed under the authority of the Director General, who has not selected them, and at the same time, they are constantly tempted to meet the expectations of the states of the region, the government that have endorsed them by election, and that will decide on the renewal of their term of office. Therefore, I would recommend, and that's the proposal 3, that the regional directors should be chosen by the WHO Director General and no longer be appointed by the ministers of health of the region. The proposal number 4 is about creating or building what I would call an IPCC for global health. As you know, one key vocation of WHO is to do knowledge building, knowledge sharing, and norm setting. And to fulfill this mandate, the organization has some specialist staff with high scientific background. They have now chief scientists, similar to the chief economists of international financial institutions. They even have now a division for research. And also they work with independent panels and committees that elaborates reports that serve as basis for WHO policy guidelines. But WHO still faces increasing challenging in fulfilling its normative activity, especially in the new extremely complex international research environment, where you have now multiple private actors that go global, that are playing a leading role in the production and in the dissemination of health research, health data, and health information. And just take the example of the Johns Hopkins University that played a major role in providing health data during the COVID-19 crisis. What would be the interest of transferring the IPCC model, which is for climate change, in the global health governance? As you know, for climate change, you have the IPCC, which is the Intergovernmental Panel for Climate Change. And the great legitimacy of the IPCC comes from the fact that it provides substantive work that is carried out by independent working groups that use contradictory debates and peer review methods. These groups has full control over the production of knowledge that they do provide. If we would transpose this system to the WHO and mix it with the WHO system, we could have a more open governance model, giving more responsibility to scientific working groups working under what we could call an intergovernmental panel on global health. And this would lead to three pillars inside UNESCO. You would have a political pillar with the World Health Assembly and the Executive Board that would adopt the global health strategy of the WHO. You would have a technical pillar with the Director General, the Secretariat and country offices, and you would have a scientific pillar with the Intergovernmental Panel for Global Health. This would have a virtue. It would be highly decentralized worldwide, linked to most national research structures, and we would be far better connected to research networks, civil society, cities, and local communities in the countries. I would go very fast for the last two proposals, since I think I'm now on 19 minutes. The proposal number 5 is to strengthen the role of non-state participation in the governance of WHO, taking into consideration that now non-state actors are major health actors in the global health governance. So it's necessary now to give them a role within the institution. And I think it would be interesting to establish a third committee within the World Health Assembly. This idea of having a third committee has been exposed 10 years ago by various analysts and researchers, and it has been abandoned. Creating such a committee would allow room for the stakeholders and partners of WHO to be able to provide proposals to the General Assembly of WHO without competing between themselves, without practicing lobbying practices, always taxes that are always still the fact at WHO. And the last proposal, and sorry, I'm a little bit long, but I will finish in a very short notice, is to improve and go further into the One Health approach that is striving to link the human health, the animal health, and the environmental health into one global framework. What I could say is that WHO has played a pivotal role in developing the One Health approach, which is essential to respond to epidemics, mostly of them originating in animal diseases and wildlife. However, the One Health approach is still very poorly implemented, and I would strongly advise a large reform of the health governance that would take into consideration climate change issues, biodiversity, urban development, and of course, any environmental issues. For that, we should have a large, high-level commission to be able to conduct an evaluation and a prospective study, such as the Brundtland Commission that was held in the late 80s to bring environmental issues into development thinking. And this commission would be in charge of giving some inspiration about a new kind of governance associating animal health, environmental health, and human health. Thank you very much. I would like to just to conclude that you understood that I plea for a conception of health as a global public good. And I think that to promote this, we should reinvent WHO. We should not sideline the organization. Thank you very much.
Thank you very much, Olivier, for all these very stimulating elements for us to thought and about global health, governance, and the reform of the World Health Organization. And I would like to recall everyone that questions are being made through Slido. So you just need to go into your Slido app and type the event code, which is 73631. People have already started to ask questions for Leslie, Paul, and for Olivier. So thank you everyone who's watching this webinar now, and please feel free to ask questions. You can inform your identity by saying your name, or you can write an anonymous question if you don't want to inform who you are. So just please feel free to ask questions to Olivier and Leslie. We're now moving with the discussion with Cecilia Osorio. She's going to make a few comments about these two presentations to stimulate this webinar even more. So Cecilia, just please confirm that you are here with us, and Olivier, if you can mute your microphone if it's not already on the mute mode.
Hi, I am here.
Thank you, Cecilia. Just let me check if everyone is seeing you on YouTube.
No problem.
Yeah, Cecilia, we can see and hear you. So please, if you want to start, just feel free. You have up to 10 minutes to discuss this very interesting presentations. Thank you very much.
Thank you, Osmany. I think I'm going to take last minute to have more room for the questions. Well, good morning to everyone from Santiago, Chile. Thanks, Osmany, for the invitation to discuss these two very interesting and challenging presentations. And many thanks, of course, to Leslie and Olivier for sharing with us your ideas and thoughts about policy diffusion and global health in times of COVID-19. I would like to share with you some comments, ideas, examples, and questions which emerge from the presentation. Well, regarding to Leslie reflections, thank you for presenting to us all the trackers and websites with information about COVID and the policy responses. It's very interesting when we see all the available information. Besides this, I agree with your main idea, the paradox of the diffusion, and I think it's very clever. I really like it. Your statement made me think whether the policy process requires certain normal circumstances to work, or in other words, policy diffusion doesn't work under crisis. We have been studying and discussing about diffusion, transfer, and circulation of policies in this network from our first conference in 2016. And I think that we were all the time analyzing the process under the normal circumstances. Does it mean we have to reframe our questions and frameworks for understanding policy diffusion on crisis? Do the role of the actor change? What happened with the mechanisms of diffusion? And I am thinking on coercion, emulation, learning, or competition, the traditional ones. I think that, for example, we could have expected to observe in some countries the mechanism of emulation. Considering governments had to take fast decisions, they could emulate as an option. Probably we have some cases. However, as Les mentioned, it wasn't the general pattern. And in the case of the South, we were observing the situation in the North. And in the we were watching our futures in the news 2 or 3 weeks in the future. We could expect that governments emulate, or even better, learn. But lamentably, in general terms, they did not. About some of the resources or factors Leslie argues to explain this paradox, I agree with all, and I would like to do some comments about 3 of them. He mentions global pandemic but local characteristics. This is a very clear statement in the case of developing countries. Inequality, weak states, the absence of a robust social protection systems affect in a significant way the capacity of government to offer a rapid and effective answer to the crisis. The structural difference among levels of development and the robustness of the state are constitutive reasons that influence the diverse answer to the pandemic. In that sense, and coming back to the former, probably Latin American countries cannot emulate nor even learn due to these structural conditions in this crisis. Therefore, the public policies to face the crisis are highly determined by the local characteristics, as Leslie mentioned. Obviously, these conditions existed before. Then what is different? I think, and it's a quick answer, that time is a key element. In some of the cases of policy diffusion we have observed, those processes occur in an extended period of time, probably more than the COVID crisis. In addition, the personal role of some actors, expert, epistemic communities, citizen expert, policy ambassador, is another relevant element. However, those actors need time to influence in the dissemination of ideas, policy programs, etc. Therefore, time and the type of actors and their resources are 2 factors which could also explain why, despite of the structural difference, we can observe diffusion under normal circumstances, for instance, in Latin America, and not under crisis. This is just also a preliminary idea, of course. Regarding to the discredit to the international organizations, I can add, at least for Latin America, the critical moment of the regional organizations. UNASUR has almost disappeared, and PROSUR is not developing any role in this crisis. In this region, we are facing the discredit and the almost null role of the regional organization. This lack of cooperation is related to the competitive responses and the useless strategy of comparison that Les mentioned. Countries are competing among them, showing the numbers and the measures taken. We have a pathetic example between Chile and Argentina some weeks ago, when the President Fernandez compared the situation with Chile, and the Chilean government complained about it. It was almost a problem of foreign policy in the middle of this terrible crisis. Okay, the reflections of Leslie are highly connected with Oliveire's presentation. He explains in detail the current situation of the World Health Organization and proposes a complete restructuration of the organization based on 6 points. His main argument is the WHO is the only forum where all the countries of the world can converge toward common public health objectives. In addition, and in the context of the crisis, he asked, what do we need for WHO? And he answered, a strengthened authority in emergency situations. He proposed a governance reform that could restore WHO institutional leadership in global health governance with these 6 measures. I would like to mention them again, just to sum up his proposal. Strengthening the international health regulation, reducing WHO financial dependence on voluntary contributions, decompartmentalizing the organization and restoring the authority to the director, building an IPCC for global health, strengthening non-state actor participation in the governance of WHO, and toward health security governance, bringing global health and the environment. His proposal is very robust and complete, and it also demonstrates his profound knowledge about the organization. In that sense, I agree with all that. As you mentioned, Oliveira, this is a normative proposal, and I would like to expect reforms in that direction. Therefore, I only have some questions. Under what circumstances can we expect a favorable context to push those reforms? Which actors are key to do that? Is this pandemic this opportunity? You mentioned the reforms occur after a previous global crisis previously. Therefore, can we expect some changes post-COVID-19? What is your projection at this moment? And finally, connecting with Leslie's presentation, what should be the role of the WHO on the diffusion of policies related to COVID or any other pandemic? I know that there are too many questions. However, I really appreciate that these two presentations allow us to think about all these issues. Thank you very much.
Thank you very much, Cecilia, for this very stimulating questions about the first two presentations. I would now move to back to the speakers, first Leslie and then Olivier, to answer the questions that were made by the audience. So just again, if you want to ask a question either to Leslie or Olivier, you need to go to the Slido website and enter the code of this event, which is 73631. It's in the comments here of this video. Leslie, we can start now with the questions to you. There are some. The first one is by an anonymous participant asking, hasn't some ideas traveled at lightning speed? Take the chloroquine example from the contested paper in France to national policy in the United States and Brazil. Another question made by the audience directed to you is, do you think crises generate both an intense focus on unique local circumstances and local policy responses, as well as stronger international outlook? Another question specifically directed to you, this other anonymous participant thank you for the presentation and asks, does your paradox reinforce the hypothesis on the relation between diffusion and cooperation? And there is one question that is not specified, has not specified the speaker. So I'm going to present this to you and to Olivier as well. It was made by DD. Has enough time passed to actually discover if policy transfer has occurred or undermined that learning has not been occurring? So I believe that these are the questions that we have for you. And of course, if everyone wants to follow the questions that have been made to both Leslie and Olivier, you can find this in the Slido app. And don't forget to complete our poll, informing from which part of the world you are coming from. Our partial results inform that 50% of the participants are coming from Latin America, another 30% from Europe, 10% from Oceania, and 5% both from Asia and 5% as well from North America. So Les, I'll now leave the floor to you to reply to these questions. You can have up to 10 minutes.
Well, I don't know if I want to take all 10 minutes, and I want to leave some time for Olivier, but and thanks to Cecilia for her observations and comments. I think if I may just briefly respond or comment on her comments, I really like that notion of time as something that we need to pay more attention to, and that actually leads to a response to the second question about whether crises generate local responses or not. And I guess my more general answer to that, but it connects to Cecilia's point, is, and I'll speak just for myself, maybe maybe to some extent the scholarly community around diffusion has tended to assume that diffusion is kind of the default. Transfer should happen relatively easily, that there are enough institutions and mechanisms and processes now, by 2020, before the pandemic, let's say, over the last 50 years, that the process of transfer should occur. It's the default, really, in terms of the diffusion circulation of ideas. And what Cecilia raises in terms of the question of time is that maybe we've taken that too much for granted, that in fact we assume that in normal policy-making contexts that there's enough time for all of these different institutions and actors, international ones like the WHO that Olivier was mentioning, even if they're weak, to just grind away and create the context in which diffusion seems to be fairly natural. And it may very well be what this pandemic has revealed to us is that it may not be so normal and may not be so natural, and that the institutions and processes that we've taken for granted are not the default necessarily. They've been built up and constructed in a fairly complex architecture over the last 50 years. But maybe the real default is there's an undertow of national and local policy responses which have to be overcome by this architecture, and it has to a large extent been overcome in the last 50 years. But the pandemic has maybe returned us to a state of nature or a state of play where governments necessarily in this context have to lead the local responses and are somewhat more reluctant to be nudged or pushed or cajoled or even advised by international organizations. So I think this has been a corrective in our thinking. And again, Cecilia's point about time, I think is something we need to pay greater attention to. And I guess maybe the fragility of this transfer architecture that has been built up, and it's a very complex architecture, as all of us know, NGOs, international organizations, corporate actors, policy ambassadors, ideas circulating, corporations, consulting firms. We've kind of taken it for granted that this dense clustering of these institutions and this architecture just makes transfer and diffusion kind of normal. And maybe it's not as normal as we've taken it to be, and maybe those institutions then that architecture can be deflected or dislodged more easily than we thought. And again, I'll connect to Olivier's point. He points out all of the weaknesses that, in a sense, were already pre-existing, but in normal circumstances, the WHO could become an agent of transfer, relatively effectively, because in normal circumstances, its weaknesses weren't exposed. So what he's shown us, I think, in a very good presentation, is that these underlying weaknesses in a context of crisis make it very difficult for the WHO to act as a normal agent of transfer or an easy agent of transfer. And then I'll just touch on the first question, which I think is quite correct. Haven't there been lots of instances of transfer of learning, of diffusion? And I think that's true. What struck me and why I threw out the idea of a paradox is that, at least in the early stages, we've seen enough countries, and Cecilia mentioned the Corona nationalism between Argentina and Chile. There have been enough instances to illustrate that governments have been at least resistant. I think there are interesting cases of borrowing, and I don't know what is going on in each and every government policy directorate or cabinet office, and how well and how closely they're following reactions around the world, or how much attention they're paying to these policy trackers. If they're doing their job, they should be paying some attention. But I took my point of departure for the remarks was just to raise the possibility of more blockage, more friction, more delays and obstructions to transfer than I have typically taken taken account of, particularly in a context where there's so much information available about what other governments are doing. And my final point in connection with this question is, of course, it's not over yet. We're in possibly the middle or the beginning of the middle of a series of interactions and actions and reactions. And again, Olivier's paper and his commentary, his normative remarks are an example of that. I think there is general recognition that maybe the international responses and the kind of effective, rational policy transfer and science-based, evidence-based reactions have not gone as far as they can. And there are a variety of actors in the think tank community, among international organizations, among NGOs, among some governments that are going now to work harder to try to enhance and improve the policy transfer that should, in their view, should be occurring and should be happening. And again, Olivier's, I think the logic of his comments are to elevate the WHO into a much more powerful agent of policy transfer, similar to the IPPC, which is a great example of a global focal point for scientific evidence and a global leader in setting standards that have become the basis for coordination and policy transfer and diffusion, and eventually, an international agreement, whatever its weaknesses might be. So I'll stop there and give the floor to my colleagues, or more questions for Olivier.
Thank you very much, Les, for all these replies. I would like only to insist on one question that, of course, you don't want to, you don't need to answer, but it appeared in the chat here from Professor Raul Pacheco Vega, where he's really interested on considering how ideas travel at lightning speed. And why didn't the use of masks idea travel so fast? For example, in Brazil, we at in the beginning of the pandemic, we were advised not to use masks everywhere, and this general orientation to use masks everywhere came after maybe 1 or 2 months after the declaration of the pandemic. So what are the struggles here? This is very important, and the time issue, of course, is something that is very interesting for us to think in our reflections about policy transfer, diffusion, and circulation.
I can just throw out two on that. I can't resist. One is, and we should recognize, and I should have made this point right at the beginning, is that it's not only a crisis, but there's a huge amount of uncertainty. We're getting clearer now about certain provisions and measures, like masks. I think there is a certain degree of consensus now that wearing masks, at least in close quarters, maybe not necessarily outside in a park, is a good idea. But at the beginning, there was a lot of dissension within the scientific community, and it was amusing and distressing sometimes to see how people would say, well, we just need to listen to the scientists. But there was actual dispute over the efficacy of masks. Speaking of my own home country, our public health officer in January actually criticized or cast doubt on the efficacy of masks. And some of that, I think, was because of shortages in masks, but some of it also was due to legitimate, scientific lack of clarity about what. And so that's been true of other aspects of the pandemic as well. So it's not only a crisis with a time component that's very important, but when you add on top of that uncertainty, a huge amount of uncertainty, you've got an issue. And then the other point I would make is that uncertainty was also fed by differences among different scientific communities. So again, the classic example here is that the public health community really was much more in favor of complete lockdowns and extended lockdowns and shutdowns, whatever the economic costs, because as experts and as scientists, they're focused on public health issues. Many in the economics community, economic policy advisors, were basically saying, you know, we need to reduce the lockdowns or move to reopening as quickly as possible in order to get economies up and running and to avoid the economic consequences. So it wasn't only that we had uncertainty, but we had different experts providing different advice from their perspectives, and there was no easy way of reconciling what the best path forward would be. And again, each path forward had to be a balance of local considerations, many of which again were uncertain under the circumstances. So I think we need to take account of those features of the crisis as well that made it very difficult for countries and policymakers just to borrow off the shelf. There was nothing certain that was on the shelf to borrow, at least in the early stages. We're getting some clarity now.
Excellent. Thank you. Thank you very much, Les, for this footnote on your answer. We're now moving again to Olivier, and if you want to ask questions or follow the discussion in Slido, you need to go to the Slido website and use the event code, which is 73631. Olivier, we have one question for you. Which was made by anonymous participants that say that in the end it's a matter of mandate. Do you agree? And I believe also there are other questions that you could comment that are in the chat. For example, in the case of South Korea, domestic social learning from previous experience was more useful than lesson and knowledge from the World WTO and other countries. And I would also like to ask you a question about the dimension of geopolitical power inside the World Health Organization and the participation or the impact of this the organization's actions into the Global South. If you could make a comment on this topic, I would appreciate.
Thank you very much. There are many questions, including Cecilia's ones, and it would be quite difficult to provide in-depth response to all. I would start by remarks made by Cecilia, and I would like to thank her for having read the first draft in French, and then after I translated the paper, I sent you, but only 2 days ago, the English version. So thank you very much for your efforts. Your key question that is also we can see in the further question you asked is it the favorable moment? Is it the window of opportunity for the global community to change the architecture of the global health governance so that we can have some more effective institutions at the global level to respond to major policy issues that are global. I mean, health is an individual question, but it's a global matter. And we have had the illustration through the COVID that the whole world can be affected in a few days by the same problem at the same time. It's the same level that a global war, a world war. So I think this is really the favorable moment. That's why I think that the major next step should be to convene a high-level commission with very high-ranked former presidents, former prime ministers, high-ranked people to envision the future. And I think this is a window of opportunity, not because of the current impact of the COVID on our life, but I think the government will change when they will see the economic cost of the crisis, and there will be a major factor for change. Larry Summer from Harvard University in a paper a few years, no, not a few years ago, a recent paper estimated, I don't know the methodology used, but he estimated that for the year 2018, the cost for the economy, for the world, for the national economies in the world of epidemics was about $500 billion. It's a tremendous number. I don't know how he did to provide it, but he provides it. So when governments will realize that the cost of health threats is higher than the cost of the response, they will provide a response at the level of the impact of the health threats. And we will see in the next month, the economies we all know that will contract themselves. We have a high level of unemployment, and possibly that would be the window of opportunity. There's specialists of institutions in social sciences, and one strong assumption for institutions to change is an external shock. And this is the shock. But let's be careful, because the memory of the people is very short, and we shouldn't wait for pushing for a reform. I would say that also the fact that the Trump administration announced that they would leave the organization, we don't know how they will do it, and we don't know still if they will really do it, is also a factor that will let us know that we need to move forward and to find new solutions, because the UN system has been for long attached to the superiority of the a bunch of countries that won the Second World War, and we are in a new world, and that's possibly the time to rebuild our institutions differently, especially, as I said in one of my proposals, to take into account the fact that the question of legitimacy, of authority, of influence has changed in the world order, and there are new actors that should be also at the table of the discussions. I fully agree with Leslie's arguments, and which was also Cecilia's one point you raised. I think WHO should not be Hydra. I mean, a tentaculous organization. I don't know if I can say that in English. A monster. WHO should do what it does the best, which is to provide information, to collect data, to assist countries that need some assistance. I think one of the most important activity of WHO is to be the national health agency for low-income countries. They don't have any research capacity. They don't have any strong national health authorities. And recently, the WHO demonstrated that there were 45 less health researchers in low-income countries than there are in OECD countries on average. This means that these institutions play a major role, not to us. I mean, when I say us, rich countries, we have the capacity to provide our authorities, political authorities, with scientific evidence-based advice. But for those countries that do not have this capacity, WHO is a major institution. And as I said in the paper, it's the only universal political intergovernmental institutions where you can build consensus. And that's also a fact that to support this institution. Is it a matter of a mandate? A matter of mandate. There was a question raised by Osmany, but I think it was written by some people in the audience. I don't think so. It's only a matter of a mandate. I mean, we must rebuild the global architecture of health, and we must include, as Leslie said, most global health actors, including private actors, including research institutes, universities, NGOs, and of course, networks from the civil society. So, of course, we can change the mandate of WHO, but it won't change the global environment. What we need to think is about changing the obligations of states, and that's in the international health regulations. If we change this IHR, this is not to change WHO, this is to change the obligations and the need for the states to comply with their obligations. The One Health approach is not a question of WHO, it's a question that should embark all research networks working on environment and animal health. So you see, I'm not sure this is only a matter of mandates. Could you repeat your question on Global South, Osmany, because the connection was not too good.
Yes, I think you already answered this in part, but it's the dimension of the geopolitical power inside the World Health Organization, as well as in other international organizations, and its relation to the Global South. Olivier?
The G77, which is a kind of solidarity between countries that are income or middle income. You hear
Sorry,
me? Hear you?
we can't hear you.
Cecilia, do you hear me?
No, not very well.
Hear you very well. Hear me.
I hear a little better, Olivier.
Talking.
No.
No.
No, I can hear you.
So sorry, this is bad connection.
Olivier, so what we are going to do is this. I'm going to because the connection is really low. So we're going to move on with the questions, and then I'll come back to you to see if the connection is better. But we are almost concluding the webinar. I just saw that questions continue to pop up here in the Slido app. So thank you for the audience for this vibrant discussion and for being so active on the Slido website. There are two comments that I would like to mention from the audience. The first one is was made by Jennifer Constantine, our colleague from the King's College in London. She's replying to Leslie's point about where diffusion isn't happening, and she says that what about the transfer happening through micro mechanisms outside the realm of state, international governmental organizations, international organizations. For example, groups like Mutual Aid UK, who provide real-time responses at the local level through learning, borrowing, emulation, but bypass the transfer architecture. So this is something very interesting that normally public policy analysts tend to look to this governmental organizations, but not often to the what's happening in the non-governmental realm. So it's a very interesting point. And the second point that I would like to highlight from the audience is the question made by the statement made by Alila Antonelli from France. She says, on what we did not have clear policy on the shelves to borrow, African states' experience with Ebola seems to have been important in adopting containment measures. In fact, Ebola was one of the first key examples of how to respond to a pandemic that we looked to with the coronavirus, as well as to the Zika virus and other situations of this nature. So if Leslie Paul wants to comment very shortly on this, and then we can move. I see that Olivier is back, so we can move back to Olivier afterwards.
Well, on the second point, that's really interesting. Yeah, local country experiences with particular kinds of pandemics and health disasters that were close to this might actually have been an ingredient in the success of some countries being able to respond. So again, some of the Southeast Asian countries had their experiences with SARS. I think South Korea was a case in point. And so they had local knowledge that didn't require diffusion from international organizations. So I think that's an important ingredient. That's an important observation to make. On the first point about other channels of transfer, that's really interesting. And Jennifer's question or comment, I don't pretend to have monitored every single channel of transfer, governmental and non-governmental. So I don't know. I was throwing this out as a possible hypothesis, and may very well be that there could have been blockages in some instances for the reasons that we discussed, but new transfer channels might grow up and around those blockages, and the NGO communities might be one. I might add one other thing that kind of goes against my own argument, and that's been, I don't know about the rest of the people on the panel, or in the audience, but of course, with the absence of in-person conferences and the unfortunate postponement of this conference in May is an example of that. I noticed that there seemed to be a surge in webinars and Zoom meetings and think tank sessions, because it was much easier. I mean, if you're a think tank and you were trying to organize an actual in-place conference of 25 people to bring them in from all around the world, was very expensive and very difficult and very time consuming. So you didn't do that very often. But to get 25 people from around the world to participate, as we're doing now, in a webinar or Zoom conference is much, much easier and costs virtually nothing. So I discovered that my calendar could potentially have been almost completely taken up with an almost infinite variety and number of policy-oriented seminars being offered by think tanks and university departments and colleges and other entities. So we may very well have had, and again, this is kind of counter to my original argument. Well, no, not completely counter to it. It just adds to the ocean of information that's out there. And again, which may be distinctive about this particular moment in time that we have here, that because of the technology, because of the already pre-existing intellectual and scientific and social science resources that were in place, the amount of real-time monitoring, tracking, discussion, exchange of ideas may actually be at a historical high around this particular pandemic and this particular global crisis in anything compared to previously, including the 2008 financial crisis. So I think that would be worth exploring as well, maybe as a complement to my argument that we may have had blockages and resistances for a variety of reasons around transfer, but other modes or channels of transfer and ideational the generation of ideas, policy ideas, may actually have increased in many ways, again, in the same context.
Thank you very much, Les, for this replies and for keeping on the discussion and our reflection on this topic. Let's see if Olivier is back with good quality of connection.
I can hear you. Can you hear me?
Yes, I can hear you perfectly.
Okay. I'm not going to use the video because the connection is not too good, and I'm quite sure that if I use the video, we will have some cuts in my response. Do you agree?
Actually, the connection was
you have still a problem to hear me.
Yeah, now I can hear you. Let's just confirm if Cecilia and Les can also hear you.
We can hear you, yeah. But again, it's
Okay.
Still bad.
Perfect. So let's move on, Olivier, and you can
I'm so
continue
sorry for
replying.
that. So sorry for that. So, yes. So I would like to respond to your question about the positioning of countries from the global South Assembly. You hear me? No, it's not good. I'm sorry. Hello.
Yes, I can hear you.
But there is a very long delay.
Yes, now there is a long delay.
You and me. So
yeah, so I think that what we can do as time is we have almost 2 hours of webinar at this stage, and I think that we could start closing the webinar, and perhaps if Olivier wants to leave a comment in Slido replying to the questions, this could maybe work in such a situation. Does it works for you, Olivier? You can write me on the chat
yes,
if you.
it is perfect. Yes.
Okay, so let's do this, and this way I think it's going to be better due to the connection issue. So I would like to start closing this webinar. First of all, by thanking everyone that has participated in this discussion, that have been working and thinking on the pandemic situation, policy transfer, and development cooperation to make this happening today. So I would like to thank Cecilia Osorio, Leslie Paulo, and Olivier for sharing their reflections with us. I would also like to thank everyone that is watching us from our YouTube channel live. Your participation has been very important for stimulating our dialogue, and this is just the beginning of a process that will last for the following 9 months with the conference. So of course, this was our first webinar, and we had a few technical issues in the beginning, but it seems to me that this is normal that we had, considering our, in my case, my lack of experience up to now with this new type of presentation, of discussion, of knowledge sharing. And but I'm very happy with the result and engagement of everyone. I would like to say two practical information. So first, this video was recorded and it will be available soon in our YouTube channel. So please, if you can, I'll kindly ask you to like and subscribe in our YouTube channel. All the conference material is going to circulate here, and you can watch also the past conference videos and have access to other material. All the information is going to be available in our website, policydiffusion.com, and you can subscribe to our newsletter to receive the information in your email. So I would like to thank once again everyone, and so we're going to have another webinar on the 2nd of September about Latin America and policy diffusion. So now I'll need to close the transmission here to use YouTube. So thank you very much and goodbye.
Thank you, Osmany. Thank you, Cecilia, Olivier.
Thank you, Osmany. Bye, Les.
Bye-bye, guys.
Thank you to everyone.